Hello and welcome to the Rethinking Education webinar. My name's Lucy Bailey. I'm founder and CEO of Bounce Forward, a national charity that specialises in practical resilience training for schools. A key area of our work is both understanding and looking at the research around the science of resilience and then turning that into practical applications that can be used in schools. I believe passionately, and backed up by the evidence, that our psychological fitness is as important as our physical fitness. And I think our education system is not only contributing to the mental ill health of our children, it's also not preparing them for what they need in the 21st century. So it's to this backdrop that Bounce Forward is delighted to be hosting this webinar discussion today. And we have a broad mix of perspectives. But I wanted to start by saying, you know, the concerns about mental health of children is growing. I mean, report after report after report tells us, you know, that young people are unable to cope with their life, that the pandemic has made things a whole lot worse, that their mental ill health, those with a diagnosed disorder, has risen from 1 in 9 in 2017 to 1 in 6 now. And the real issue for me is that we're unable, first of all, to deal with the demand, those children that have a diagnosis. It's about a quarter of those who are diagnosed are not in contact with a specialist. So we can't respond to demand. And the other thing for me is that we just don't connect the dots. So the research tells us that children and young people are seeking support in schools, but what we're not doing is, you know, supporting the system and the structures of schools to be able to do that. And the second for me is that there isn't a magic wand around mental ill health. So, you know, there's not just like a, you know, one size fits all. So this is the backdrop for this webinar, and we're going to discuss the intersection between education and healthcare systems and the essential role of schools and teachers that they can play in both promoting the health, the physical and mental health of children and young people. We're joined today by Nancy Hay, a global leader in the field of wellbeing, who set up What Works Wellbeing, the What Works Centre for Wellbeing, which is the UK's national body for wellbeing evidence and practice, aiming to understand what governments, business, communities, and what we should all do to improve wellbeing. Chloe Lowry is a former teacher and a lead author of the upcoming journal of the Royal Society of Medicine series that is diving deep into the nexus between health and education. We're going to then move from this national perspective into delving into some case examples. So we've got Stuart Linders, Vice Principal of the Lee Academy, the first school in the country to be awarded the Healthy Minds Kite Mark by Lord Layard, who's Professor of Economics at the London School of Economics. Stuart has 20 years of experience in education and is one of the most experienced teachers in terms of health education and life skills in the country. We have Professor Neil Humphrey, Chair of the Sarah Fielden Psychology of Education from the University of Manchester. Neil's experience spans child mental health, social emotional learning and special educational needs. Neil is currently academic lead for Be Well, an amazing project which is being rolled out across Greater Manchester that combines academic expertise with youth-led change. And then we're going to finish the session by doing a bit of blue sky thinking. And we've got Minesh Patel, who's a GP partner at Moatfield Surgery, and until September this year chaired the National Association of Primary Care, whose mission it is to really improve population health by supporting health and care systems. And then Natalie Williams, who's Mental Health and Education Manager at Oldham Council, who's a former teacher herself and joined Oldham Council and has been instrumental in raising standards and improving outcomes for children and young people through the Oldham Opportunity Initiative. Her work has delivered significant changes to the way schools consider wellbeing as part of school improvement and planning. So, you know, we've got a wealth of experience. And so I wanted to start really with Nancy to kick off your perspective really from a national and economic perspective. Why does wellbeing matter? Why should we be paying attention to it?
Thank you, and it's fantastic to be here. I'm really, really excited to hear different perspectives that we've got today. So I'm going to share some slides. I'm going to talk about it, how it fits into the Treasury context, why we know that children's mental health is important and what we can start to do about it with the slides today. So I'm going to talk about the valuation of wellbeing, which sounds really technical and geeky, but this is why what Lucy and co have been doing is so important and what we can learn from that massive investment and how we can take it and implement it more widely. So what are we doing when we're talking about well-being? So the Treasury, when it thinks about well-being, is talking about what it's trying to do. Is the Treasury is trying to understand all the significant costs and benefits of any choices that they're making, any spending decisions that they're making that affect the welfare and well-being of the population, not just market effects. So we're talking about non-monetized impacts. And this welfare and well-being consideration in the Treasury process applies to the entire population, not just taxpayers. So that includes children and young people. And that is important because when we're talking about well-being, we're talking about how we're doing as individuals, communities, and as a nation, and how sustainable that is for the future. And the future is our children and young people. They will be the adults of our future. So that is how we help ensure the sustainability of well-being of our nation, our communities, and of course the people within it individually. The guidance in the Treasury has two things that are particularly interesting that happened this summer. So one is that we have the valuation of well-being guidance that allows well-being measures and evidence to be used in that consideration of spending. The second is we have a schools policy appraisal guidance that applies that guidance for spending in the schools context. And those two new documents are linked on the screen. But that basically allows us to look at non-monetized impacts across the whole of the policy process. It allows us to look at a strategic stage. What are we trying to achieve? Why does this matter? Which I'll talk about in a second. It allows us to choose a broader range of options about how we meet that objective, how we shortlist it and appraise it and put some numbers to that. So not just saying, oh yes, there are wellbeing benefits. Well, what are they? Who are they for? How big are they? When do they occur? All of these sorts of things allows us to do it in the rigor that we would do in any other sort of project. And crucially, monitoring and evaluation. And what we've been able to do with Healthy Minds is evaluate that and look at the impact on wellbeing that allows us to use that evidence in this process for decision making. So that's what we're doing. It looks really technical. It basically means that we're allowed to use wellbeing evidence and research in policy making and decision making across the whole of government, but also in the schools context. And there's guidance to do that robustly, consistently. Now, why does this matter? We've got UK national measures of wellbeing. They look at our subjective well-being, our relationships, or what we do, where we live. It includes skills and education, all the things you'd normally see, but also how you feel about your life. And that is what we're talking about here. There are children's data as well. That's provided by the Children's Society, and I'll talk about that in a second. This is what happened nationally over the last 10 years to subjective well-being across the nation. And you can see there are variations in well-being across the nation on the left-hand side, where you can see darker areas are on average happier and lighter areas are more miserable. And so there's variation. And what we're talking about when we're levelling up well-being, we're talking about making sure that you can live a good quality of life wherever you are across the nation. This is what happened when the pandemic hit. So you can see how they move. You can see that life satisfaction plummeted. Our purpose stayed reasonably high, which is fantastic. Happiness bounced around all over the place. It's the only one back to pre-pandemic levels. And anxiety went through the roof in March 2020, is now much more level, but still not pre-pandemic levels. So you can see that at a national level, but we can also see this at a school level, we can see this at a community level, we can see that at a workplace level, and we can see this at an individual level too. This is the children's data. This is the Good Childhood Report. They provide the national statistics on children's wellbeing for the nation, and they've got data for the last 10 years, and you can see there that satisfaction with life as a whole has decreased since 2009. Although what's interesting is satisfaction with the schoolwork has stayed the same over that period. So there's something going on, particularly satisfaction with school, appearance, friends has dropped. Satisfaction with family, which is fantastic, has stayed the same. What difference does it make, though, when you're prioritizing well-being as a goal? So you're looking for things that really aren't affected by how somebody else is doing, so that you can get a win-win for everybody, where there's fewer adaptation effects, so things that you don't get used to, so you don't have to keep applying these things. So unemployment is a big one there. And this basic safety net, has everyone got a good enough standard of living? And that takes you to three priorities. It takes you to employment, which schools have been always focused on, but it matters for those 500,000 people a year who don't go on to higher education. Can we get everybody into jobs that are good? Then mental health is a big, big difference. And then social connection and loneliness. And we saw that satisfaction with friends, for example, in that previous one. So we looked at social connection and supportive friends. And we know that for long-term resilience for young people, Public Health Wales have done great research that show having a trusted adult, supportive friends and weekly sport make a massive difference to long-term well-being over time. Mental health really matters. So what we've been able to do with the London School of Economics team is look at the origins of happiness, and particularly look over time. So using cohort data, which the UK is brilliant for, follow people over time and see what makes the biggest difference. And one of the things at adulthood, at 34, we see the top 3 drivers of adult subjective well-being are mental health, and together with physical health, that is huge. Secondly is whether or not you've got a partner relationship that's good. And the third is employment. But that you're not fully formed at 18. We know that emotional health in childhood is hugely impacted, obviously for your experience of childhood, but also as for a later adult, and your mother's mental health as well has a long-term impact. So looking at perinatal mental health, children's mental health out in the school setting, we can see the impact of schools from the age of 10 years old all the way upwards, and we can see that in later life. So this is really exciting and tells that one, mental health is really important and schools can make a difference in that setting. We were able to, using these metrics, understand from, we're investing 1.3 million in the development of healthy minds, taking the research that we know and translating it into action, and then evaluating that impact in terms of what happens when you use it. And we were able to bring together evaluations for children and young people using those metrics, and Healthy Minds evaluation is an example, and we can see an increase in life satisfaction, that overall metric that is used in the Treasury guidance from this programme. So the question is, how can we really make use of the learning from that 1.3 million we've invested so far and reach as many secondary schools as possible? That's the wider context. The other thing to say is more generally that schools-based interventions can work. This is the Early Intervention Foundation, another What Works centre in this network of What Works centres, and they looked at interventions for young people's mental health based in school, and they found, for example, that universal social emotional learning interventions have a good evidence base at reducing symptoms of depression and anxiety in the short term, and we do know that that can have an impact over the longer term as well. So these things work. How can we make it happen more consistently across the country? And we can put some values to that. And this is the geeky bit that we end up doing. We can understand and compare different types of intervention as to what makes the biggest difference and what value in terms of well-being life is created. And we can put values on that stand up in a business case. So that's why it matters. So thank you very much for letting me do a little introduction to the hard work that is happened before and is going on afterwards.
Nancy, thank you so much. I mean, for me, you know, when you have, you know, it's part of trying to connect the dots, isn't it, of thinking about, you know, these sort of national, you know, understanding and data, and then how you can, you know, start to really use that in practical examples on the ground. So thank you so much for sharing that. And we will make sure in this webinar that we have links to the policy guidance that you've mentioned. So thank you very much. I'd now like to just, I don't know, continue on that sort of national picture really, and hand over to Chloe Lowry, who's been writing this series for the Journal for Royal Society of Medicine. And I know you've been sort of drilling down, thinking about what a system might look like based on your work. So yeah, Chloe, I'm going to hand over to you.
Thank you very much for having me here today. And I'm really looking forward to sharing with you all some of what we've found in our research when we've been looking at the relationship between health and education and the impact that that has on young people. So let me just share my screen with you. I just actually was starting with some of the same statistics that Lucy mentioned right at the beginning, because for both, I guess, this webinar and for our series, the starting point for what we're thinking about is children's health and where we're at. And where we're at is really concerning, both in terms of physical health, if we think, for example, about childhood obesity, but also in terms of mental health, with now 1 in 6 children having a diagnosable mental health condition. And as Lucy mentioned earlier, the support that children need to deal with these problems is just not in place. So only a quarter of children who have a mental health problem actually receive the specialist support that they need. And the current NHS target to improve on that is only to treat 1/3 of those children. So that's still 2/3 of children who the NHS are even not aiming to treat, who are suffering with mental health problems. And if you look at this data from the Children's Commissioner, comparing what the NHS spends on adults' mental health with what the NHS spends on children's mental health, it's really worrying. Not only is it not equal, but actually what you'd want to see is more investment in children's health. Because as Nancy mentioned, kind of health and well-being in childhood has an impact throughout the lifespan. It has a really disproportionate impact. And the earlier that we can intervene to make sure that children are healthy, the much higher chance they'll be healthy as adults. So what we actually want to see is more investment in children's health, as well as having some investment in adults' health. So from what we see, it's clear that actually there needs to be more investment in children's health, particularly when it comes to mental health. And what we argue in the series, and what I'll be arguing today, is that a good chunk of that investment should be going to schools and to teachers. And I'll be explaining why in the next 2 slides. So this slide here is taking a snapshot of the data from the Social Needs Observatory, which is done by the Royal College of GPs. And what they do is they collect live data from 1,800 GP practices that are representative of the country as a whole. And you can see this is over time, shows you the last 2 years or so. And this is the rate of a particular issue. Here I've chosen issues related to mental health and how that appears in the population. And you see something very strange if you look at the 0 to 17-year-old group, which is the group we're talking about, which is it appears to be completely flat along the bottom. If you look at the actual data, they're actually very small amounts, but it's compared to the others, it's very, very flat. And what that tells you is that children and young people, despite the mental health conditions and the rise in mental health conditions that we've been talking about, are not going to their GPs to talk about these problems. And so the question is, well, where are they going? Where are they getting support? And the answer to that you can find a little bit further back in the Mental Health of Children and Young People in England survey, where they asked 5 to 19-year-olds with a disorder what types of support they had received in the last year. And the most common source of support was actually a teacher. And that was used by about half of children with a mental health problem. It was even more common to speak to a teacher than to have support from family or friends. And you can see that GPs and other traditional primary care professionals saw about 1 in 3 children with a mental health problem. And you still worryingly have a quarter who have no support whatsoever. This reflects in some ways the fact that teachers are considered to be tier 1 of CAMHS and provide kind of universal services in this way. So this graph fits in with that function that's recognised in seeing them as tier 1. But what you can also see is actually that's just one example of the wider impact that schools and teachers have on children's health and their lives. Because adults are part of generally multiple different environments. They're kind of homes, work, where they relax. But for children, they have 2 main environments, the home environment and the school environment. And so in the series, we look at the school determinants of health, how a child's health can be impacted by their school. And this is a figure taken from one of the papers in the series. And you can see just starting at the kind of very physical level, children's health will be affected by what happens during break times. Do they run around and play? What happens during PE lessons? How often do they have PE lessons? What do they eat in the canteen for lunch? Just in a very physical way, schools will impact their health. There's also the dimension of what skills are they learning or possibly not learning in things like personal, social and health education lessons. Are they effectively being taught health literacy? Is their social and emotional learning being developed? What kind of behaviours are being modelled to them and are they learning? Thinking about the community, do they have a trusted adult like Nancy mentioned? Do they feel like they can go to their teacher with mental health problems? Why are half of them going to their teacher and half of them not? What about that quarter who still have no support whatsoever? Also thinking about the level of social norms. Research has shown that actually there's a lot of variety between schools in things like smoking. Some schools have a smoking culture, and it's much more likely if a child goes to that school that they will smoke than if they go to a school that doesn't. And at the kind of most zoomed out level, you've got their sense of meaning. And within that, the idea of connectedness is really important. The idea of being valued by the people around you. And in terms of school connectedness, that's being valued by your teachers and your peers, or that experience of being valued. And that's been found to have incredibly significant health impacts. So for example, adolescents who do feel connected to their school, that's the strongest protective factor they could have for decreasing rates of substance misuse, risk of violence, early sexual initiation, risk of injury. And it's the second strongest factor after feeling connected to their family for decreasing rates of disordered eating, emotional distress, and suicide. So the school environment is really, really key for children's health in both the short term and in the long term. And within that, we particularly focus on the role of teachers. And I want to tell you about two studies that were really influential for this series and what we explored, and the way that they show teachers' role in children's health. And the first one, the quality of social relationships in schools and adult health, a very recent study. It looked at this domain of school connectedness, and it looked at separating out the impact of feeling valued by your peers, positive pupil-to-pupil relationships, and the sense of being valued by your teacher, having a positive pupil-to-teacher relationship. And what they did, which was really powerful, is that they looked at siblings, because then they could control for family background factors, including those that you don't normally control for, the unobserved factors. And when they did that, they found that the significance of positive pupil-to-pupil relationships for adult health mostly disappeared. It mostly depended on these unobserved family background factors. But the relationship between pupil-teacher relationships and adult health was robust. It wasn't affected significantly by family background factors. So regardless of what kind of family the child came from, if they had a positive relationship with their teacher, that had a really significant impact on their health in the future. And it was such that having a 1 standard deviation improvement in pupil-teacher relationships had really significant health gains, both in general health, physical health, mental health, and health risk behaviours, equivalent to completing additional years of schooling, which is used because it's one of the most reliable determinants of health. So that's one study. The other study that shows teachers' impact really shows what range of impact teachers have on children's health. They don't just have on children. They don't just impact their academic test scores. They also impact their mental health and their social and emotional learning. And so for this study here, when they used longitudinal data from 10,000 British primary school students, they looked at their scores on the Strengths and Difficulties questionnaire. And they found that actually children's long-term future outcomes, so in terms of employment, in terms of education, university, etc., what mattered was both teachers' ability to improve academic test scores in combination with their ability to help them develop socially and emotionally and improve their scores on the Strengths and Difficulties questionnaire, and thereby reduce their chance of mental health problems. And what's really interesting about this is that the school system is very good at collecting data, looking into, enhancing teachers' ability to improve test scores. But there is very, very little that goes into looking at teachers' ability to improve SEL and enhancing that. And the difference was such that if you replaced a teacher in the bottom 10% of their ability to promote this social and emotional learning with a teacher of average ability, that generated a lifetime earnings gain of £25,000 per child. And if you think about how many kids a teacher teaches every year and over their career, you can see just how significant any ability we have to improve teachers' ability to promote SEL will have on the whole generation. So what I've said so far, essentially, teachers play a vital primary care role. They are providing frontline services for children with mental health problems. They play a vital public health role in their long-term impact on children's social and emotional development, and in the positive pupil-to-teacher relationships that they can create for children. But what we really focus on in the series, and I want to focus on now, is that teachers are not actually trained for either of those roles. And this is a real issue. there was a review of initial teacher training provision in 2015, and they decided that there should be a core curriculum delivered by all providers. And in this curriculum, they included these key areas: children's emotional development, their mental health, being able to recognise typical and atypical development and respond. But when the government actually finalised this curriculum in 2019, this was all gone. It was solely focused on essentially improving lessons. And that means essentially improving test scores. And there was no training and nothing on the curriculum that would actually help teachers develop children's social and emotional learning. And this is worrying because 97% of teachers actually want training in children's mental health in recent surveys. And the government at the moment currently funds a one-day training course for one teacher per school in mental health awareness. So that's what teachers are currently being offered and experiencing. Now that's all teachers, but another group that you want to focus in on is those teachers who have particular responsibility for delivering health education, so PSHE education teachers. When it was studied in 2011, it was found that 90% of them didn't have any specialist qualification, and 75% of them had no training at all. It will be even lower than that now because this specialist qualification, which was only a 3-day course, is no longer government funded, and interest in it plummeted after that. So it will not surprise you that one of our key recommendations in the series is training teachers, both developing degree level qualifications for health education teachers so that they, just as a maths teacher will have expected to do a degree in maths, a health education teacher will have studied health education degree level, and also training for all teachers in child development, health and well-being. We're not training teachers to be health professionals. We're not saying that, but we are saying teachers should be experts in promoting healthy child development. So that should be integrated into teacher training, but also delivered now to all current teachers, because we can't afford to wait a generation, for the teaching staff to have these skills. This is something that our children need now. Secondly, we recommend creating child-centered services. So schools are where children are and where they go to when they need help. So teachers can't by themselves solve all of the problems of society. Children need access to social workers, social prescribing link workers. Schools is where they are and where they go for help. So we need to make services available to them in school where they are. And thirdly, we need to measure what matters. I've talked about it and Nancy has talked about it. Academics is not the only thing that matters, and it's not the only product of the school system. You have those really valuable people to teacher relationships. You have wider impacts on health, and you have the impact on social and emotional development. So we need to be collecting data on that. Schools need to know how their students are doing in terms of their health and their well-being, their relationships with teachers, so that they can actually begin to improve in these areas. And we don't have time to talk about it, unfortunately, but also teacher well-being is a really important issue because teachers themselves are suffering from poor mental health. And if you were to have this data, what you can work towards is something that we called a learning education system, which is named after an idea in healthcare of a learning healthcare system. And the idea is that once you have data that you see at the bottom in grey, you can begin to get these feedback loops. So schools will be able to understand the needs of their pupils. That means, say, in health education lessons, you can tailor what you're teaching to the needs of those pupils. And then you can see, okay, well, has that worked? Has that made a difference? How are our pupils doing now? You can do that at a whole school level as well, the whole school approach to mental health and social and emotional learning. So you can have these learning loops at a school level. But if you have this data, you can also do something else. You can aggregate it and you can begin to evaluate different approaches. What is the best way of teaching social and emotional learning? What's the best way of delivering a particular topic in health education? A lot is currently not known about this. But if you were to begin to aggregate this data and evaluate it, you would be able to answer those questions. This could then feed into teacher training. So specialist training for PSHE teachers, and initial teacher training for all teachers. And then that will obviously feed back into the practice in blue, which means they will be able to use the latest evidence in their approach to dealing with children and their needs. So that's obviously a kind of long-term vision of where we could get to that would create a system that works iteratively and continuously to enhance children's health. But these 3 recommendations are things that can begin at individual and more local levels immediately. There are courses out there that will train teachers to support student mental health and will train them to deliver PSHE education. There are already investment in schools in, say, mental health support teams in schools. Is something the government has started to do. We want to see that rolled out across the country and also applied in other areas of children's services. And there are initiatives already, and I think we'll hear from Neil later about initiatives to collect school level data on people and teacher wellbeing. So these things are already happening, and the more that we can push them forward, the more that we can help the next generation live, be set up for a healthy and happy life. So thank you for listening to that. Sorry, it was quite a lot.
Thank you so much. Yeah, you were able to, to give it very, very simple terms, like very clearly what is must be, very complicated series. When is it being published? Do you know?
We don't know yet, I'm afraid. It's currently in peer review at the moment, and that can take a variable amount of time.
Okay, thank you so much, Chloe. And as you say, what's lovely for me is that some of the recommendations that you're making there, we now have 2, so we're sort of coming from the national and sort of coming back down now into what practical applications are happening on the ground already, and to really just give the sense of that there are models and examples out there that we can really learn from, and to be able to take forward. So we're going to start with Stuart Linders, and it's interesting you say about teacher training, because I know you think about, not suggesting that every teacher in the country should have this, but Stuart has attended 19 specific days of training on how do you facilitate learning around health, education, and life skills. So I don't say it very lightly that, he is one of the most experienced teachers in the country. So Stuart, I'm going to hand over to you, and you're going to share your case study that happens at the Lee Academy.
Yeah, thank you very much. I think I'm the most qualified PSHE teacher in the country. I was once told that. So thank you very much for having me and giving me this opportunity to speak about Healthy Minds today. Lucy is kindly offered to run through, open the slides for me. So just a bit about me. I'm a Vice Principal at the Lee Academy in Dartford. I've been teaching for 22 years, 20 years at this place, but I oversee behaviour, personal development. I'm the safeguarding lead, wellbeing lead, and oversee RSHE. So I'm doing a lot around the mental health of our students. It's quite interesting to hear the other guys talk about how there has been a significant increase in the number of students who are having issues from anxiety and stress and low mood, self-harm, because we've certainly seen an increase in that over the last few years. So we wanted to put something in place, not only in terms of counselling and supporting the students, but also in terms of the curriculum. So just to sort of get to an overview on the next slide, just a bit about sort of Dartford. We're a secondary school in Dartford with 1,500 students. We're surrounded by 3 grammar schools, 4 large council estates, and the demographics of Dartford has changed significantly over the past few years. It brings a large number of challenges into the local community, and obviously along with the pandemic, we've had to overcome lots of difficulties, from criminal exploitation to the well-being of our students, and so we're working very hard with our students at the Lee to become more resilient and overcome some of these problems. So what you've got is our Lee learning journey on the next slide, and you will see that we're determined to take students on a journey throughout their secondary school experience. We want them to challenge. We want them to be challenged. We want them to become independent. We want them to be ambitious and have aspirations. And some of those students don't have the aspirations to get out of Dartford, but we also want them to become resilient learners. And when they begin their journey from school to life, which is one of the modules that we teach, We want them to actually excel and want to go and to see places and do things and create their own bucket list and actually get to do the things that they maybe never dreamed of doing before. But we also put the well-being and mental health of our students at the heart of what we do. We also we've always had a really good extracurricular experience and opportunities for our students with big events, trips and visits and visitors coming in. But Healthy Minds is our RSHE curriculum that we've worked with Bounce Forward for over the last few years. And that is at the core of what we do. It's the heart of the school. All of the students are fully aware of the lessons. The staff are fully aware of what goes on. Our parents are, our governors are, and the SLT really do a lot around Healthy Minds, even on things like open days, whether we're having Parent Teachers Day like we've got today at school. The language is used. We talk about Healthy Minds a lot, and it is used on an everyday basis. So we were the first school, which we're really proud of, to be awarded the Healthy Minds Kite Mark. And we received that via the London School of Economics and Lord Richard Layard, as we were part of that national pilot involving sort of 12,000 students from across the country, something that went on for 5 years. And the outcomes proved for us as a school that Healthy Minds had an impact on things like attendance, on the well-being of students, and even reducing fixed term exclusions and improving behaviour. So we've maintained that as part of our RSE policy for the past 7 years. We do have a number of trained teachers. There's definitely more work to be done on that due to the pandemic, but we train staff to deliver it from LSAs to our pastoral team through to teachers that we recognise as possibly having great relationships with the students. But we also have a number of SLT delivering lots of our Healthy Mind lessons to different year groups. We know that students are on board and engaged, and I'll be able to give you some feedback on that a little bit later in this presentation. But we also work very closely with parents, new staff, and we were really pleased with a recent Challenge Partner review where we were given a status of excellence in terms of our Healthy Minds curriculum. And so therefore we're now offering local schools and schools within our trust the opportunity to come and see how Healthy Minds is at the heart of our school. The lessons are very much around discussion, debates, and there's no assessments, and what we value is student feedback and participation, making sure that they feel safe, they feel comfortable about talking about various lessons, and that has also come across in some of the reviews that we've done. So we want to train all available staff, and those staff actually that are given Healthy Mind lessons, they want to teach it, and there's very few that want to have that removed from their timetables. And when they leave, we know that often they're going into new schools and using those skills to deliver those lessons in their new school environment. And we also know that Healthy Minds has a huge impact on some of our SEN students, those students that have been identified with some of those mental health illnesses or vulnerabilities. So again, overall, we really sort of value why we began this Healthy Minds journey. So why is it so valued? We feel that a number of students with sort of anxiety, low mood, stress, that self-harming, we know we're improving their well-being, and we've managed to do some research on that. We know that the course content is relevant, it's updated regularly. The key topics go from resilience through to relationships, to sex ed, to drugs, to alcohol, and then the links into mental health. And then certainly in the older year groups, they really value looking at things like parents under construction and how that's then related into the well-being and relationships and the links into mental health. And actually when we tried to take it away from the year 10s, because we needed to maybe increase more maths and English time for exams, there was people knocking on my door demanding that we put it back onto the curriculum, because they felt so strongly that the work that they were doing in year 10 really helped with their exams. So actually we reviewed it and we put it back onto the curriculum, and now every year 7, 8, 9 and 10 all have one lesson a week for 1 hour having their Healthy Mind lessons. And we've expanded the curriculum to include things such as gambling, such as county lines, gangs, criminal exploitation, as well as then looking at those mental health issues. We also know that Students need to reflect and practice what they learn. So we're encouraging them to go back into their houses, talk to their parents, show them their work, and actually having these conversations. And we're able to now set up some parent activities through NHS Trailblazers and working with some of our external companies that come in as well. So that's something that we've learned from doing this. And we know that it sort of meets and exceeds all of the RSHE, personal social health education, which obviously is standard practice in all schools now. And we know that the RSHE curriculum, we know that the Healthy Minds course covers 90% of all the things that we're expected to know in the relationships education and sex education, things that we need to teach. So again, on my slide, you'll be able to click into the Lee Academy RSHE curriculum. And again, I'm more than happy to speak to people about how we did that. And we know that there is a little bit missing, but we now cover that in science, in PE, and through things like ethics. So I've talked about how we have 1 hour per week. I think it's important to also say that we don't just give these sessions to staff that are under allocation. We make sure that we suitably choose those staff members that we feel will deliver these lessons the best. And they're one of the first teachers that we look to get their timetable sorted at the start of the year. What it's also allowed us to do is look at the personal development section. And actually we're able now to link Healthy Minds in with lots of our guest visitors. So things like relationships and sex ed, we've now got people coming in from various charities that work with us. So such as recently we've had Fitter Stronger come in and work looking at the well-being of our students, but also like diversity role models that were in yesterday, and looking at the changes in relationships and issues that come up in the LGBTQ community, for example. So Healthy Minds and personal development go hand in hand together, and we're able to really expand on that curriculum by having these visitors and having these events to showcase. We also link it very much into the 3 R's at the school of respect, resilience, responsibility, and then opening minds to success is our ethos in the school. So Healthy Minds is always talked about around these areas, even whether it being just telling a student off for silly behaviour, that challenging behaviour. We always go back to that Healthy Mind language. The student services manager, the pastoral team use this language as well when they're speaking to the students about being more resilient and overcoming adversity. And then looking at the curriculum on the next slide, we were lucky, obviously, as part of the initial pilot. And I did my large number of training by going to these workshops and learning from numerous trainers and other colleagues. So we use this as the basics, but we've also now got the new curriculum that's excellent, really well resourced, gives great opportunities for teachers just to use the resources and be able to deliver it without that much training. I've also managed to develop my own Google site, my own website that my staff use. All of the resources that we've got from Lucy and the team are now on that website and so easy to use. The curriculum is adaptable, it's flexible, and more importantly, it's about real life. So the current issues that we've got within the pandemic, we had 6 resilient lessons based around lockdown, the mental well-being, resources excellent and allow great discussions and some debates within their classes. And that again was recently picked up at some of our observations done by some of the trust executives that came into school a couple of days ago. So some feedback from the students. So I've done a couple of surveys over the last few years. I try and do it every 2 years. And the most recent one, we had sort of 283 responses from a range of students from year 7, 8, 9 and 10. And the results speak for themselves. The students really enjoy participating, with 96% saying that they did. Did they make them more confident? Did they make them more resilient? 91% felt that was the case. And then I think this is really important, that would they recommend Healthy Minds to be taught in all secondary schools across the country to benefit things like mental well-being, to increase their resilience, make them more aware of the media and the impacts of of various things within their life. And actually, it was a resounding 95% said that all schools should do that, which was great. So in terms of sort of our overall results and what evidence have we had that is impacted our students. So we know that there is greater support for our younger students in making critical decisions. They're able to think for themselves. They're able to become more confident. We know that there's been an increase in self-confidence with our most vulnerable. That is evident just by conversations that they're having every day, the assessments that they're doing in other subjects. We know that students are thinking very clearly about a career path. So one of the things that we do this module with Year 8 is From School to Life. We've had 6 lessons, and so many of them are creating wonderful, fantastic timelines of their journey from the age of 13 to 60. So where will they be in 2060? What they've conquered on their bucket list? But what forks in the road are they going to have? What are the obstacles they've got to overcome? And some of them are actually talking about the mental health issues that they've got. Some actually opened up and talked about self-harming, and actually the support that then's been put into place to support that, which again is very courageous and brave for them to then sit there and write that and actually talk about that in front of the other students. We know we've got a great number of students with higher aspirations to travel, to go and do things, to get out of Dartford, which has been great. They understand what makes a healthy relationship. We know that the amount of domestic violence in the local area went significantly up over lockdown, and we knew we wanted to actually get students to understand what is a toxic relationship compared to a healthy relationship, and what they can do to support their family, and what they can do to gain a better understanding of that. We also try and put in act of kindness fortnight, anti-bullying fortnight. They're put into the school year, and we've also got the middle years program at the school, which the students are then doing a community project in Year 9, and again it's all based around some of the Healthy Mind stuff that we're doing. We also know that we've had less fixed term exclusions. Our attendance after COVID was at 95% for the entire school. The national average was at 89%. Is that just down to Healthy Minds? Probably not, but actually has it had an impact in some of the lessons that we did when they came back to school? I think that's probably true. So there is a video when BBC Breakfast News came into the school, and again I think that speaks volumes. So again, that's something that can be maybe played by some of the people that obviously log on to the webinar and check it out. But again, if you've got any other questions that you want to know about setting up Healthy Minds in your school, any questions, then please contact me on my email, stuart.lindars@leeacademy.org.uk. Thank you very much.
You said yourself it was, not in a way there's sort of a luck of being involved in a project, of that scale. But I think the way in which you have implemented it and made it a real sort of part of the ethos and culture of the school, I think is absolutely down to your commitment. I remember on those first days, those training days, you said, what on earth is all this about? So the fact that you're now sort of advocating for it and offering that opportunity for people to come into see for themselves how it works is amazing. Thank you so much for that. And yeah, now I'm delighted to, we've been talking about, teacher training is important, how we think about teaching and learning around students. But what about how do we really make this something that we care about, in terms of the education system? And I think, measuring well-being, making it as important is really, is key part of that, as Chloe mentioned. So I'm going to now pass over to Neil Humphrey, who is going to share with us how wellbeing is being measured consistently across Greater Manchester.
Thanks, Lucy. Thank you. So I'm just going to share my screen. My name's Neil Humphrey and I'm the Sarah Fielding Chair in Psychology of Education at the University of Manchester. And I'm going to talk to you, give you a bit of an overview of the Be Well initiative, which has just been launched across our city region. First thing to note is our shiny new website, which is www.gmbwell.org. What is Be Well? So Be Well, in a nutshell, is about making young people's wellbeing everybody's business. It's a new programme that's led by the University of Manchester, the Anna Freud National Centre for Children and Families, and the Greater Manchester Combined Authority. And it combines two key things. One is academic expertise and the other is youth-led change. And the kind of central tenet of Be Well, in addition to focusing on improving young people's well-being, is that we need to engage with and involve young people in the decisions that we make about them. So everything that I'm going to talk to you about today in the overview of Be Well has involved consultation, extensive consultation with young people. From the very small decisions to the major decisions on the project, young people have been front and center in helping us to make those decisions. So things like the logo for the initiative, which you can see there, was designed by a young person, was voted on from a range of options by young people. The measures that we're using were informed by young people's views, and so on and so forth. So this is very much a youth-led initiative. And the kind of, I suppose, the short summary is we will be surveying the wellbeing of young people in Greater Manchester from this autumn. So we've actually started. The surveys are actually underway at the moment. We've got young people completing surveys for at least the next 3 years. And we'll use the data that generates in collaboration with schools and partner organisations to deliver positive change. So this is about measuring what matters to young people and to schools and to communities, and using the information generated in order to act for change. So just say a little bit about our funding and partners. So we've been able to build a very large project, mainly thanks to the very generous funding that we've received from the University of Manchester, the Combined Authority, and then a whole range of philanthropic funders, including the Horwood Foundation, National Lottery Community Fund, Paul Hamlin Foundation, and others. We're also extremely fortunate to have built what we're calling the Be Well Coalition, more than 70 partner organisations. Some of them are local, some regional, and some national, and even some international. And they are all, they've all committed to acting on the evidence that the Be Well survey generates. So we have service delivery partners, so organisations like 42nd Street and Place to Be, business partners, so organisations like the Timpson Group, and then funding partners and research partners. So we're working, for example, with the Education Policy Institute. So we've built this coalition, and they will help us to act on the data that we generate. And I'll say a little bit about that in more detail shortly. So I just want to start with a little bit more on the context of why we decided to develop this initiative. And the first thing to say, I suppose, is that this was something that we were planning even prior to the pandemic. And then everything that's happened with the pandemic and what we know the impact of the pandemic has had on young people's mental health and well-being has only strengthened our resolve. So we know that prior to the pandemic, 1 in 9 children and young people experience significant mental health difficulties. So to put that in context of a classroom of 27 children, that's about 3 in every 27 children who would experience significant mental health difficulties. We also know that from NHS Digital's research that number grew to 1 in 6 by last summer. So the pandemic had a direct impact on the prevalence of significant mental health difficulties among children and young people. So that's about 4.5 children in every 27. And we know also from a recent report by NHS Digital that prevalence figure has stabilised. So even though schools are back in business, so to speak, in terms of face-to-face delivery and so on, and life in schools looks as close to normal as it has done for some time, the children's mental health hasn't suddenly recovered, and we know that the impact of the pandemic is going to play out over years, not months. We also know from the Children's Society, who were mentioned in one of the previous presentations, from their research that young people's wellbeing has been in decline for the last decade. And then finally, in terms of useful research findings, we know that the peak age of onset for lifetime cases of mental health difficulties is about 14.5. So when you're in year 9, year 10. And that's important because we need to be trying to work out when can we best intervene to prevent lifetime cases of mental ill health, which we know are devastating for individuals, but also have economic consequences and all the other consequences that we heard about previously. So we developed Be Well. You won't be able to see any of the detail on this screen, for which apologies, but this is basically just to show you our theory of change, which was co-produced with young people. And I'll give you the highlights in the time that I have available. with a theory of change, we always begin with a question around what's the problem that we're trying to solve. And when we consulted with young people, it was essentially around three things. The first was young people's well-being themselves, so that they recognised that there were issues with well-being of children and young people. They also, though, highlighted that they felt that their voice in society was not heard clearly enough, that they often felt ignored and excluded. And then finally, they felt that the system around them was not designed to prioritise well-being. So the education system and the broader social systems were not designed to prioritise well-being. So these are our three foci: focusing on improving well-being, focusing on increasing young people's voice in society, and then what we've called pivoting the system to well-being. And we have a range of audiences because we want to make this as broad as possible. So we're not just focusing on the role of schools here, we're also focusing on the roles of wider society and communities, voluntary community sector organisations, health providers, and so on. And we're basing this premise that if we generate and provide high quality data on a very large scale that can be used to inform change, that can act as an impetus. So that idea of what gets assessed gets addressed, and that we can then use that energy to basically to create positive change in schools and communities. So there is a research project embedded within this. I'm a researcher, and so I always think of these things in terms of research design. So what we're doing in Be Well is we're doing what's called an adapted population cohort study. So that has two elements to it. One is that we're going to track children and young people rather from age 12 to age 15. So there's a cohort of young people in Greater Manchester who are currently in year 8 who we're surveying right now, and we'll survey them again next year when they're in year 9, and then the year after when they're in year 10. And then we also take a cross-sectional snapshot of young people's well-being, of those that are aged 14 to 15, so those that are aged in year 10 once a year. So we've got children that we can track over time, and then we've also got those that we take a cross-section of the same age group once a year. We've recruited so far, very happy to say, over 200 secondary schools across Greater Manchester. So in fact, 210 as of the last update. That's more than 90% of mainstream secondary schools in our city region. But it also includes many independent schools, special schools, alternative provision sites, pupil referral units. One of the key elements of Be Well is that we want it to be as inclusive as possible. This isn't just a project for typical mainstream secondary schools. It's a project for all young people, and so we've worked very hard to try and engage non-mainstream schools in this project. Based on the recruitment of schools and based on the year groups that we're working with, the sample that we're hoping to generate data on is somewhere in the region of about just under 70,000, just over 70,000 rather, young people. So it's really one of the biggest projects of its kind ever to have been implemented in this country, or indeed any country. So what are we going to do? What are we going to ask them about? Well, we designed our survey again in consultation with young people. So like everything else in Be Well, the survey content and the questionnaires and so on that we used was developed in consultation. So we engaged with 150 young people across 15 schools. So a series of workshops that our project manager undertook with young people in schools across the city region, including mainstream and non-mainstream schools, alongside input from a questionnaire advisory group. So we had a brilliant group of academics, health professionals, teachers, more young people who had interest and expertise in young people's well-being and the drivers of well-being. And then we were able to take what young people told us mattered to them. So in those workshops, we asked them about, well, what does well-being mean to you and what influences your well-being? They told us. We were able to summarize that information, take it to the questionnaire advisory group, and generate together a framework for the assessment of well-being, which we then mapped existing scales and items from previous research onto. So what young people told us well-being meant to them was essentially three things. So they talked to us about the fact that well-being is very much about meaning, purpose, and control. So things that we kind of categorized under meaning, purpose, and control were their sense of autonomy. So how much agency and independence did they feel they had? Their sense of satisfaction with their life, and also their sense of optimism for the future, that things were going to be better in the future. They also talked to us about well-being being about understanding yourself. So their psychological well-being, their self-esteem, how they could deal with cope with stress, their ability to manage their emotions. And then finally, they talked to us about the experience of emotions themselves. So the negative emotions, the sadness, the loneliness, the anxiety, but also the positive emotions, the happiness, the joy, and so on. And then they gave us a really comprehensive sense of what the whole range of things were that drive and that influence their well-being, which we've categorized according to health and routines. So things like their physical health, the amount of sleep that they get, their nutrition, the amount of physical exercise and activity they get, their hobbies and entertainment, so how they spend their free time, how much time they spend on social media and what they do with that time on social media, their participation in arts, culture, sport, the kind of, I suppose, the richer, broader tapestry of life, their relationship with school, so how they feel they belong to school, relationships with staff, how happy are they with the grades that they're receiving. Interestingly, also, though, they talked about environment and society. So they talked about their local environment, their home environment. They talked also about the experience of material deprivation. And then, unsurprisingly, they talked about relationships. So they talked about relationships with parents and carers, with friends, experience of bullying, experiences of loneliness, but also experience of discrimination. And then finally, they talked about the future. And so because they talked about the future, they're interested in things like opportunities for work beyond school, developing skills, life chances, and so on. So we're collecting all of that data from young people in a big survey that we've developed alongside them. They're also going to provide their residential postcodes so that we're actually able to do some really interesting and cool place-based analysis. They're going to report on their gender identity, sexuality, and then we have background data provided by local authorities, things like ethnicity, free school meal eligibility, special educational needs, and so on. And the point of gathering all of this background information is one of the key aims of Be Well is to be able to start to identify and address the inequalities that we know exist in relation to young people's mental health and well-being. So we're able to kind of do that through this kind of large and rich data set. Final thing to say just in terms of the surveys is, again, with the central tenet that Be Well is to be as inclusive as possible, we knew that what's quite a lengthy survey wasn't going to be appropriate for young people with more complex needs who are educated outside of mainstream settings. So we've developed 2 adapted versions for young people in non-mainstream settings. One is a truncated version with visual anchors to help them to understand and interpret the questions that we're asking. And then another is a symbol-based version using widget symbols, which are used in many special schools. So we consulted extensively with some special schools and some young people from special schools to input into the design of that. And then those young people get to choose which survey they'd like to take with the support of adults as necessary. So all of that data as a researcher gets me very excited. I'm a bit of a data geek. But the point of this is not just data for the data geeks like me, it's actually to inform action. And so what we do is this hopefully kind of simple explanation of what we intend to do with this data beyond write interesting papers about it. We already have developed from a previous project a data dashboard that we use to provide bespoke aggregated feedback to schools that can help them interrogate trends in their well-being and drivers of well-being data to help them understand what's going on for young people in their school, to evaluate the success of interventions, and to make sure that well-being is at the kind of center of everything the school does. We are also, though, for Be Well, going to develop a neighbourhood data dashboard. So if you can imagine a map of Greater Manchester and the 66 neighbourhoods across the city region, that will also provide data feedback for communities and for our 70 plus partner organisations so that they can identify neighbourhoods that might need additional support in specific areas. The schools data dashboard, the schools get support from the Child Outcomes Research Consortium. So they have a model that we've used in a previous study called Head Start that's funded by the National Lottery Community Fund. They work with schools to help them interpret their data and to help them to think about what that data might mean in terms of informing their provision. And then the partner organisations, the 70+ partner organisations, they then provide the support for communities. So they have committed to using the neighbourhood data that we produce to help to look at a kind of a hyper-localised approach to wellbeing support. I want to finish just briefly, just to highlight our big event, which happened a few weeks ago. So we held our first, what we hope is the first of many annual Be Well Days. So we hosted it in something called the Mayfield Depot, which was has been used for many things over the years in central Manchester, but most recently was a rave venue. And we had over 200 young people attending from schools and youth organisations across the city region. We had a whole range of activities for them, creative activities, get moving, workshops. We had online and and in-person creative commissions. So we had some brilliant musical performances, but all of it was driven by young people and what young people told us they would like to see. And one of the significant achievements of it, which I thought would never happen when the idea was first raised, our youth steering committee came up with the idea of a Be Well bus that could tour the city region and go to different schools, and schools could then, young people could come out and create a kind of a living work of art by graffitiing the bus with positive messages about what well-being means to them and what makes them thrive. And when I heard this idea, I thought that would be brilliant, but how on earth are we going to get a bus? How on earth are we going to do this? Transport for Greater Manchester donated a bus. The Manchester Airport Group donated drivers. We drove the bus around schools in the city region, and as you can see from the photographs there, young people from across the city region had a tremendous amount of fun graffitiing the school bus with, as I said, those very positive messages about what well-being means to them and what makes them thrive. So it was a tremendous success. So in summary, we want to do three things with Be Well. We want to listen to young people's voices. We want to act together for positive change. And most importantly, we want to celebrate young people's well-being. We want this to be a very positive project that emphasizes well-being rather than the kind of, I suppose, the doom and gloom version that quite often is in the media. There's further information on the website, but we're also on social media. So there is a GMB Well Twitter account. We're on Instagram, we're on LinkedIn, we're even on TikTok. And of course, more traditional ways of getting in touch like email. So I will stop sharing there. And thank you very much. I'm done.
Neil, thank you so much. Oh my goodness, I'm in such awe of, the idea of a place, that is, everybody's involved in it, and and what I love that comes out with Be Well is the interconnection between what's happening in the classroom, into the home, into the community. So thank you so much for spending the time to share it, and we will make sure we share the contact details on the website as part of getting this out to people. Thank you so much. So we've heard from a national perspective in terms of, the research and the evidence around why wellbeing matters. We've then come in to think about, okay, some very, let's face it, well-funded projects through, what has been the commitment and the support from, from a sort of a few people from outside of the system, thinking about, what could we do if we could put some resources together and to get people involved. And so I wanted to finish today's webinar really with two voices really from where I think the core funding comes from. One is health and the other is local authorities, right? Because at the end of the day, that is where our systems work in terms of how we resource these things. So we're not saying any of these things are happening now, but I wanted to first of all hear from Minesh Patel, who I said in the beginning, who until recently chaired the National Association of Primary Care. The aim of looking at how can we improve population health by looking at supporting healthcare systems and, you know, perhaps maybe not thinking about, you know, so many silos around what is health and what is education, and, you know, because young people don't make those distinctions themselves. So Minesh, I wonder if I could invite you to share your perspective on the potential of what could happen in your view if we were, I don't know, to have a magic wand and to make some of this stuff work, you know, not just in particular areas, but across the, you know, across the country.
Oh, thanks, Lucy, and you know, thank you for inviting me to this really interesting webinar. And it's great to hear some of the amazing stories that are going on. It makes me feel much more positive about some of the things that may or may not happen. I mean, I for one, well, first of all, I'm actually a jobbing GP. That's what I do most of my week, other than supporting sites to sort of improve the things that they do, helping them to on their improvement journey. But I echo some of the points that Stuart made and Neil made around the scale of the challenge that we now face is so enormous that we cannot put any more sticking plasters on how we approach young people's mental health. I know of a survey that was done across a cohort of 16 to 25-year-olds. It was a national survey, and that seemed to indicate that around a quarter of people in that group were unable to cope with life. And for me, that's a staggering figure. And that's probably even, you know, it's an even greater number as we've sort of gone through the pandemic. And I recognise that from my personal experience in general practice in primary care. And we've certainly seen a decline in people's mental health. And certainly from where I sit, some of the key challenges have really been around the sort of disconnection of services, disconnection of support, but more importantly, actually how we work upstream. And that's really how we start to tackle some of the population challenges. From a primary care perspective, accessibility, I think, has always been an issue that we've faced. I think it's really difficult sometimes for young people to really summon up the not only the courage, but also the ability to access some of the services can be quite a challenge, even when people want to. And I think all too often we treat people like patients, and young people need to be, you know, quite rightly treated in an altogether individual way that we sometimes sort of forget. So looking at some of the potential solutions, I think it's really about building those effective partnerships across the system. But the system is not just the health system, as you've said. It really has to be across health and education and local authority. And I think we're still in the foothills, really, of understanding that and actually making some of those changes happen. But more importantly, I think it's also about engaging those young people in designing the support that's being sort of developed around them. And I'm really pleased to hear some of the work that Stuart and Neil have been leading, because it really does mean that we're going to make positive change that actually resonates with the people that we're trying to support. We've really got to talk to people who know more about this. And I think in health, we sometimes think we know everything that there is to know about improving the health and well-being of our population, but that's so not true. And, you know, talking to colleagues and just listening to some of the colleagues here makes me realise even more that we need to spend much more time getting a deeper insight into some of the things that sort of happen. But we've also got to look at some of the wider determinants of these poor outcomes that we face. So we know that just as with adults, we could be, you know, I could be seeing someone with anxiety who has an altogether different sort of set of determinants from another, where actually we need a much more socially based set of interventions that perhaps we're not geared up to deliver. So it's really about understanding these needs much more carefully before we start to reinvent services. And all too often we tend to develop services that are quite tiered, because we're in effect planning services around failure, aren't we? We're planning services around escalating challenges rather than planning for success as upstream as possible. So I think we need an altogether different mindset. And again, I'm pleased to hear that that's sort of changing. We've also, whilst we look at the digital world as a risk for young people, we've also got to look at the digital world for solutions for our sort of younger population. And often the way that they interact with digital tools is so much more sophisticated than potentially adults might do. So I think we really do, and again, I think from a health perspective, we're really in the early stages of really understanding how we can build tools for younger people. I analogize by, I looked at a tool quite recently, which has actually been developed for youngsters who have type 1 diabetes, but it's a gaming-based tool. And I don't think in a million years I would have ever thought of developing a tool like that, but actually it came from the mind of young people. And this is a tool that actually helps them to manage their care and support themselves in a much more effective way. So we've got to really start putting young people in the driving seat in terms of engineering the solutions. At a more local level, one of the things that we've done, we recognized quite early on that we were going to face a major challenge around escalating mental health needs. So we set up a teenage focus group in my town, and out of that actually came a number of really interesting and important sort of changes for us. I think it really made us think about how we create access for young people. So we've created sort of dedicated email and telephone lines that youngsters can use, which enable them to sort of access our services a little bit more effectively than perhaps they did before. We've upskilled and developed liaison GPs who regularly communicate and liaise with teachers, but also with school counsellors and school nurses, so that we've got a better understanding of some of the needs that they're facing. And some of the risks around some of the youngsters that are in their care. I think, as Neil said, what that doesn't necessarily do, though, is to broaden the capture of all those people who might not necessarily be in education at the time. So it's an area of development for us, really. What we've also managed to do in that time is to understand how we all work. I think culturally, there is such a difference between health services and education and even local authority that even formulating the right language around the way that we work is a step forward. So I think that's been quite a journey for us. We've also, I think, moved on from just working out how we work together. We've got to somewhere where we think, well, actually, what about the future of those children? How can we start to interact with them differently? So we've used a lot of those focus groups to then start thinking about, well, how do we engage youngsters in perhaps a career in health? Might they want to volunteer for certain things? Might we want to support them in their efforts around, for example, Duke of Edinburgh awards? And so we've done an awful lot of work around trying to engage our youngsters in not only sort of developing our services, but also hopefully helping to develop them and their future journeys as well. And I think we've still got an awful lot to learn, but that is our story. And coming back to wider scale deliveries, I would point to places like Calderdale alongside Manchester, Greater Manchester, as sites that have really taken a very different approach. And you'll be familiar with the Thrive model, which is a much more sort of upstream population-based approach, rather than this sort of traditional downstream escalating health crisis approach to care, which an awful lot of services unfortunately deliver. So I think we've got a lot to be positive about, but we've got an awful lot of work to do to work together to deliver that.
Manish, thank you so much. I just absolutely love the idea of planning services for success and the whole idea of a strength-based approach. I mean, we just, really always come at things from a deficit approach, don't we? So I really love that idea. And I've spoken to the colleagues in Calderdale, and I just think it's an excellent model. and yeah, talk about, you know, local authority perspectives really, which leads us really nicely into Natalie Williams, who leads on mental health for Oldham Council and has been, you know, instrumental in the Oldham Opportunity Area Initiative. And Natalie, I'd really just like to hear from you in terms of, you know, the model that you've applied in Oldham, but really just giving us a local authority perspective. You know, why is this of interest, or should be of interest from your perspective from local authorities? I'm going to hand over to you.
Thanks, Lucy. So I think more than ever, I mean, health and education working together needs to be is really pivotal in terms of aligning their priorities. And I kind of noticed this when I was in schools teaching 16 years ago, that there was an increase in mental well-being and mental health of children, and that teachers weren't skilled enough to meet those everyday needs. So from that, I then moved into the local authority, working on the whole school approach to emotional health and mental well-being. And for me, it was an opportunity really to really align health and education together and really support schools to meet the needs of those increased challenges that they're facing on a day-to-day basis. It wasn't through the staff within the local authority and within schools. It wasn't the fact that they didn't have the skills or the confidence really to meet those needs on the ground. So it's been my passion over the last 3 years with myself and my team to really embed a whole school approach and really give the confidence to people that are seeing these children day in, day out on the ground. Not only the confidence to meet the needs, but the understanding behind it and being able to face those difficult challenges that they have on a day-to-day basis and have true impact. Because as we know, most of our children, when they are moving down that mental health continuum, it's not necessarily a specialist health service that they require. It's that trusted adult that they can be empathic and understanding to. So for me, it's around letting the children choose who they want to support them, who their emotionally available adult is. So as a team, we've been working really hard over the last 3 years to be able to give teachers the confidence to be able to have those wellbeing conversations. So it's a needs-led approach rather than us saying to the children that you need to go to this qualified person to speak to, because they haven't got the relationships. And that's going to be common throughout everything that I said this afternoon, around relationships are absolutely central to well-being and moving things forward. So as I said before, aligning health and education is really important. Within Oldham, we have a really diverse range of need. And from that, we were selected as an opportunity area, which brought in quite a bit of funding. So we're really privileged within Oldham to have my team. So with myself, who's an education background, and I actually have 2 psychotherapists in my team. And that works really well in terms of me having that education background and then having the 2 psychotherapists in my team who are really upskilled in terms of the mental health need and that the more health aspects of the role really, and combined and working together, we've supported schools to complete self-assessments. So we have 110 settings in Oldham, and we've over the 3 years we've now got mental health senior leads across all of our settings, and we've supported them to analyse themselves across the 8 principles of the whole school approach, looking specifically at first around leadership and how it was going to be strategically managed, and then trying to filter out what was their priority right now. And a lot of it has been around upskilling the staff to have those wellbeing conversations, but also to support staff to understand behaviours of communication and understanding when a child is displaying certain behaviours is for them to be able to respond in the correct way. So in terms of our team, then as I said, we've got 110 senior leads. We've got a huge wealth of connection and networking that we do within our schools. We have networking meetings with these mental health providers, but we see our team as that link through between health and education, and we bring providers in, and we coordinate all the local services around universal and selected interventions in Oldham together, and we filter that information into the schools so it comes across in the right way. Because as you can appreciate, the language barriers between health and education is sometimes really quite mixed and quite complex, and quite, you know, even sitting in the local authority and working over the last 3 years, I'm still trying to get my head around, you know, different referrals and pathways, and it is really quite complex. So as a team, we try and filter that to schools so that they can truly understand. Schools have really taken this on board. They've highlighted it as a priority within their settings, and most recently in our self-assessments, 70% of our schools now have mental health and wellbeing on their school improvement plan. And not only do they have the senior leads, but the majority of our schools have steering groups around this. It's not just focused on that senior leader now, it's filtering down throughout the whole structure of the settings. And this includes into looking at the pupils now, because I've talked a lot about upskilling the staff around key mental health concerns and having wellbeing conversations, but it's the pupils also that we need to upskill, because we all need to know ourselves, know our own triggers, be able to take notice when we are moving down that mental health continuum. And that's where I was pleased that I met Lucy Bailey, and we worked with Lucy over the last couple of years within schools to roll out the Bounce Forward Healthy Minds curriculum, and we've had huge successes and uptake and feedback from that. And I think coming from the PE teaching background, it's that true understanding that resilience is a skill, and understanding our own health. And if we don't give the children those skills, then how do we expect them to cope as well? So it's a two-pronged approach, upskilling the staff and then upskilling the children to be able to take notice, to think, why am I feeling the way I am? And then how can I help myself? And if that's not working, where can I get the support from? And that's the bit of work that we're doing in terms of supporting schools to have those clear lines of pathways. So 75% of our schools have now said they're fully ready for the RSE and the health curriculum, which is massive. It's a huge journey, when only 20% of our schools in Oldham explicitly taught PSHE 3 years ago. So, you know, in terms of, I suppose, rethinking that, schools are just having a change of mindset too, in terms of they're seeing the importance of this health education. But it's fortunate that our schools have got a team like me, and we've got funding the way we have from the opportunity area to be able to really invest in this and really get the schools on board and support them, because schools are busy places, as we all know, and it's very difficult, and it is a priority for them. But if we don't support them to make it easy for them to bring these things into their setting and upskill them and give them the resource and the tools and support them on that journey, because it's not just about the training, it's about having that whole community in the sense of that we're all working together. And like I said before, we have a variety of networks. So we have the networks around the curriculum, we have the networks around the mental health leads, and then we have that shared stakeholder commitment where we invite key partners from third sector, health and education to come into the room to really drive things forward in Oldham. An example of that is that we've most recently become part of a mental health support team, which is a true blended model, which includes Pennine, which is the NHS, and our local charity, which is Tog Mind and Place to Be. And we and ourselves at the local authority, we all work together to support schools. The beauty of it is that our schools had the foundations from the whole school approach, so they were ready, they could identify need, they had the leadership structures, they had pathways so that they could identify these pupils to be able to receive these selected interventions. So 29 of our settings have an educational mental health practitioner 1 day a week. We went for the 1 day a week model because we really wanted it to be an integrated approach. So we wanted schools to see this health professional as part of their setting, that was part of their environment. So they were a staff member, rather than seeing them as an add-on that they send the children to, and then that's their responsibility to come back. We really wanted it to be integrated into their systems, really feel part of the school and part of the school culture. And that's really supported those schools, because when universal isn't enough, you know, we do need to have those clear pathways of support, and having that intervention in the school has made it easy, accessible, and and it helps the right children being identified in terms of accessing that intervention sooner. And I think that's one of the key things, is we need to be investing more on that early identification and prevention, because having that top-down approach, because otherwise we'll end up firefighting those crisis levels, and it's high cost, isn't it? You know, if you've got a team like me, we're quite relatively cheap in terms of some of the crisis interventions. So having a team, and there is only 3 of us, but the impact that we've had in terms of bringing Oldham on this journey and pulling key partners together and then rolling out these mental health support teams in schools has been really pivotal. And within Oldham, I think that we're really privileged to do that. But again, there are challenges in terms of the language barriers and the funding coming through the door, that only 29 of our settings are getting this additional support at the moment. But luckily we have got our team there who are then able to identify other low-level selected interventions. And what we found is that this has started to decrease exclusions within schools. So behaviour has started to improve, and therefore the capacity within the system has started to be less pressurised. I suppose with our CAMP services as well, what they're seeing is that there are higher referrals through schools, but they're starting to see more appropriate referrals, because what we're seeing is that gradual response, instead of schools going straight from the universal to that targeted high level services. Schools are pausing, assessing and thinking, what can we do? So that's where schools are starting to having that rethink, to say, you know, this is part of our role too. It's everybody's role of the well-being of children, and with the upskill of some of the internal members of staff to meet those needs first, and then when that's not quite right, stepping up to that selected intervention, and then moving on to the CAM services. And like we said before, that does sound like a tiered approach, but we really push it should be a layered approach. So every child still gets that universal support, as well as the selected and the targeted on top. It's not one or the other. And that's something that we really push. So in terms of Oldham, I think one of the key things for me was relationships and really getting to know the schools. So bringing people together, because we don't know what we all do. Education wasn't really clear about the CAM services or what was on offer, and in terms of their world, their work. And I think our role has been integrating those two worlds together and just getting people talking, because what I found was there was so much good work going on in Oldham, but it was really fragmented. It was done in parts and parcels in terms of different teams, which was great. Some really fantastic work. What we've been able to do now, we're talking and working together as a system, is bring all that together and then really bring Oldham on this journey. And it is a journey, and we're not at the end of the journey. We've got places to go in terms of some of our targets and meeting needs, but we definitely I'm confident to say that the mental health is of high importance within our education settings, and we are supporting our children to be able to thrive, and educationalists are understanding the impact of a mentally well child in terms of progress and attainment, and how those two go part and parcel together.
Wow, Natalie, thank you so much. I mean, you said you covered so much there, but I just love that idea of, at the end of the day, there's what you say, 3 people. So your team is not a massive, but the difference that it makes to having that leadership that can help to, navigate the system, break down the language barriers, and all really sort of bringing people into this idea of a sort of a shared understanding that delivers on outcomes. And, I mean, we started this webinar with Nancy talking about, both the short-term impact that investment could have, which I think you're already starting to see. And then I think the real question comes, almost a couple of years down the line, doesn't it, when you really start to see the pressure ease within the system. And as you say, this is not about saying that young people will not need specialist support, but it's about making sure those that need the support are the ones that are in the system, because then that, so Thank you so much. You know, and it's been an absolute pleasure for us to bounce forward to work with Oldham, and you know, and I would encourage anybody to seek out and have a look at the model there, because yeah, you know, it's truly a model that I think should be replicated across the country. So thank you so much. What an interesting conversation. Thank you very much to all the speakers that have joined us. I wonder if we might finish the webinar by asking you to just give us 2 short sentences, really. One, from your perspective, what is the biggest challenge that you think we face in terms of, you know, making some of this happen? And if you had a magic wand, what might be the key thing that you think we'd need to do in order to solve the problem? Nancy's given me hers because she had to leave to go to another event, and she talked about, you know, the idea of, which I'm sure, I don't want to steal Neil's thunder, but the idea of regularly measuring well-being from sort of key stage 2, because, you know, what she's saying, unless we start to think about the standard of teaching and learning, particularly around health and well-being, then we're not really going to take it seriously. But Chloe, I wonder if I could pass to you, what would be yours?
Well, this might steal Manisha's thunder, but I was thinking what he was talking about the very siloed approach to health and education and this lack of working together. So if I had a magic wand, it would be putting a kind of local health coordinator in every school to link up what's going on in schools to what's going on in healthcare systems, because actually everyone ultimately wants the best outcomes we can have for children and young people. So actually getting them to work together like that.
Thank you, Chloe. Stuart, can I come to you?
Yeah, I think there needs to be more training available for all staff when it comes to the well-being of our students, and also things like counselling. We just are so battling against like numbers. I only last week I had 4 students in one day brought to me for self-harming. You know, that takes up so much of my time, supporting the family. Parents are obviously upset about that. Students then need that support around them, and we went from having 2 counsellors last year to 1 counsellor. So the investment in money in terms of schools and the support that we need. You know, I often refer to myself as being a vice principal, but I'm also a police officer, a support worker. You know, I'm in charge of the COVID testing at the school. You're not trained to do that at university, and the last 5 years has taken its toll, not only on myself, but my teaching team and all the people that work with the wellbeing of youngsters. So definitely more money invested in it, more time given to training, and maybe some time on the curriculum full time for every student across the country. That was longer than 30 seconds. Sorry.
Yeah, but it was so powerful, Stuart. You're absolutely allowed to. Thank you very much. Neil?
Okay, so I've been having to think about this, and I think without just wanting to say I agree with everything that my colleagues have said, which I do, I think the biggest challenge for me still that kind of underpins all this is that kind of health and well-being doesn't have the parity of esteem that it deserves, particularly in terms of what schools are pressured to prioritize. It always comes down to the educational outcomes, but we know that well-being is just as important, you know, concurrently, but also prospectively in terms of life outcomes. So we need that kind of pivot in the system, as I mentioned before, around prioritizing well-being. If I could wave a magic wand, I would make all schools sound like Stuart's school, because it sounds wonderful and the work that's done there. But you know, in terms of things that I think, you know, we could do, we can't wave a magic wand suddenly and make every school like Stuart's school. You know, it would be about things like training and resources, and you know, and starting right at the beginning. So this needs to be if schools and school staff are expected to be undertaking mental health work, which they very much are, then this needs to be a much more central element of initial teacher education, so that teachers coming into the profession feel skilled and able and confident to deal with these issues. And then continuing professional development for serving teachers. There needs to be much more made available for teachers and other school staff to engage with, because they're being asked to engage in this kind of work now, and they need to be, you know, we wouldn't dream of asking somebody to teach a maths lesson without giving them the training that they need to deliver a math lesson. So why do we expect it when it comes to health and well-being?
Thank you so much, Neil. Yeah, totally 100% agree. And Manesh?
Well, caveating that I agree with everything that everyone has said, in particular Chloe, who stole my lines. I would say that a happy, healthy workforce is really critical here. If I had a magic wand, that would be the one that I would wave. We know in the health setting, and there is evidence for this, that an unhealthy and unhappy workforce create risk, and there is a reduced quality of work and increased mortality, in fact. And I would analogize that if we had a happy, healthy teaching workforce, that actually the quality of not only the teaching, but also that mentorship, that very, very important mentorship that happens throughout a young person's life and is critical to their future, would be also of greater quality.
Yeah, thank you very much. And echoing Stuart's line about, he's a teacher, yes, first and foremost, that's what he qualified in, but actually he wears so many different hats, and he's a person in, we're people in amongst all of that as well. So, Natalie, what would yours be?
So I think the biggest challenge for us is I suppose sustainability and funding, and having that security within the system, that a team like mine would be able to still be there in terms of pulling everything together. And I suppose because once you've got a team that's embedded within a system, then you can start to really make change. But if you're on short-lived funding, knowing that you're only going to be funded for the next 2 years, and the next 2 years, it's really hard to sustain within the system. So I think in terms of that, the biggest challenge, I think that's the biggest challenge. In terms of my biggest wish, I suppose it's around having that early identification and prevention team that integrates across health and education in every local authority. So including educational psychologists, including in the early help section, social workers and CAM services, all coming together as one early identification team, that we can all really start making that impact from that bottom up in terms of an approach. And I suppose then in terms of progressing that forward is around then sharing the data, because when that early identification happens, and having those smooth kind of pathways and systems that enables parents, professionals and children themselves to navigate the system easily. So having a key champion that would be able to support that process, so a child or family or professionals not having to talk to numerous different groups to be able to get access to the right support at the right time. So having that true integrated system with a multi-agency team.
Thank you, Natalie, and thanks to everybody. Yeah, I mean, wouldn't it be amazing if we could wave those magic wands and get that going? I suppose I might finish by saying, if that one of the key challenges for me is about our mindset around how we respond to young people, and sort of building on sort of Manesh's point, really, do we see young people as a problem, or do we see them as a resource? And so for me, it's about shifting that mindset. And my magic wand would be, that we start to really look at young people as resourceful, that it's about empowering them to have the autonomy to make the decisions that they think are important, because young people are resourceful, they are our future, and so we need to start thinking of them in that mindset as opposed to our problem to solve. Thank you to all my panel. Thank you very much for those of you that are listening. We will make available the various resources that we've discussed during this webinar. Most importantly, something that Natalie said actually about, this isn't just about young people, we're all human beings, right? And so we all need to model and look after our own well-being as well, and not because of any ill health, but just because it's a good thing in itself. So I hope you all have a good rest of the day, and yeah, thanks for listening.